Hi, welcome. Thanks for coming to kcbd.com. My name is Dr. Roberta Beals, and we're going to be talking about some procedures done at our clinic at the Healthy Skin Clinic located inside of Grace Clinic on Marcia Sharp Freeway. Annie has come to me in regards to changes in her skin. She's a young female that is a professional that is concerned about how the sun damage has affected her skin and how she looks at herself. And she's concerned that the sun damage over a period of time will contribute to changes such as skin cancer. So during our consultation we talked about options, and what we're going to do today is a BBL or light treatment that will target the chromophore, which is the skin pigment that she's concerned about, and get rid of it. And as you look on the video, you'll see that the redness, which is a form of rosacea in the early stages, and the dyschromia, which is the brown pigment from sun damage, can occur even at her age, and it gets unfortunately more severe as we get older. In an older adult, it's going to be more red and lumpy, and you'll get very thickened skin with this, and your pores will become enlarged. And a lot of women do not find that attractive and want treatment. And so Annie's being proactive about getting that taken care of today. The BBL treatment is nothing more than UV light focused on that chromophore, so it's safe to leave afterwards with just some sunblock. Your pre-op treatment is just some topical numbing medicine, and it's very safe to drive afterwards. So as you can see, Annie's got a mixed skin challenges, and she's young, and she wants to get a more homogeneous color to her skin with this treatment. And so what we're going to do is target the brown and the red. And as you see with the alcohol, you can see it shows up red on her cheeks and her chin, which is a form of rosacea, even though she's young with it still. As you get older, you get thicker skin, and it starts to dilate blood vessels, and you get big red spots. So she's really being proactive and getting this taken care of now. And then the brown color is from hyperpigmentation from sun damage, and she wants to get those out of the way because they'll come up in crops as she gets older. Alright, she doesn't have a lot of wrinkles or anything because she's young. Now we're going to put some gel on there, and then we're going to cover your eyes, Annie, okay? Okay. Alright, because we want to protect her eyes. Because this, even though this is just a light treatment, we don't want to have any problems with your eyes. So the brown will get brown and crusty looking, and the red will turn out more red. But after this procedure, you can go about your business, put on your sunblock, go back to work. So a lot of women will get this done on their lunch hour. Okay, Annie, I'm going to put gel on your face. We're going to turn your head to the side so I can do this whole. Now on this mole here, all I have to do is cover it up. Okay. So that your body won't touch it. Gotcha. Okay. So I'm going to do around your eye first. Okay. Okay. So we're going to pull down just a little bit, make sure we get good gel. Now when we're around the eye, it's very bright because of a reflection throughout the back of your eye. So don't panic or anything. It's just really bright. You might want to squint because it's a natural reflex. Okay. Okay. So for you, sunblock is going to be very important as you age to keep and protect your investment here today. So, okay, ready? Good? Yeah. All right. Okay, just let your lips relax now. Kind of purse your lips just slightly, and we're going to treat your lips, okay? because believe it or not, you do get sun damage around your lips. Okay, we're going to wipe some of that off now. And you do get skin cancer on your lips just like you do on the rest of your face. So. And it doesn't look like the rest of your face, so that's why we want to make sure we get that. Okay. Tuck your lip in again. There you go. Now the reason why I bring up the discussion of relax your lips, skin cancer, is because Dr. Bitterman did a study at Stanford over a 10-year period to look at what does this technology do to your skin long term. Because we wanted to make sure, I'm going to do your nose now, okay, sorry. We wanted to make sure we weren't causing problems by doing this long term. And it turns out the genetic test that they did showed it reversed damage in the skin by turning on and off the genetics in the skin cell. And then they started looking for things like precancerous lesions, such as actinic keratoses, which lead to basal cells. And what they found is that it treated them. So currently, it's under FDA investigation or studies to see if we can use it to treat precancerous lesions, decreasing the overall onset of skin cancer. We're going to treat the nose. And interesting enough, there was no increased incidence of melanoma or any other forms of skin cancer. And these studies were done in California, which is huge incidence of skin cancer. And once you have one skin cancer, you will have an increased incidence in getting another, even a different type. And the other studies show that melanoma is more common in areas like Washington State and Alaska, and not the basal cells and squamous cell. So more studies are being done now to determine if this will be beneficial in that population. But it's good to know it hasn't caused any more. Okay, as you can see, this is a really good example on her face. She's a lot more red, spots are standing out. So she has a lot more rosacea on this side of the face than the other. She doesn't have as much brown spots or dyschromias as she did on the other. And there's no melasma, which is one of the things we want to look for. But this is a very good clinical response that we want to see. So I think you'll be really happy with this. Thanks for checking out our video. Call or contact our office through email or phone. And you can never tell when we're going to have a special, so it might be a tattoo removal or one of our other procedures that are available on our website.